Kiran Patel is rushed into the emergency room with sudden, total paralysis in her legs. She cannot feel any sensation below her waist. Her daughter Varsha reports that the weakness began as a stumble on the stairs and progressed within hours. Doctors perform a physical examination, but the results are contradictory. Kiran's muscle tone is normal, yet she remains immobile. A full neurological workup follows. The CT and MRI scans return clean. There are no spinal lesions, no nerve damage, and no autoimmune markers. Physically, there is no medical reason for her condition. Dr. Charles, a psychiatrist, begins to probe Kiran's personal life. He discovers a specific timeline. The symptoms began exactly when Kiran started vetting suitors for Varsha's upcoming arranged marriage. Charles suspects conversion disorder, a condition where internal mental conflict manifests as physical disability. During a high-pressure consultation, Kiran's heart rate monitors begin to scream. She suffers a respiratory crisis as the wedding is discussed. The psychological wall breaks. Kiran admits her own arranged marriage was a misery she endured for decades. She confesses she has been unhappy since the day she took her vows. Her paralysis is not a disease, but a physical refusal to let her daughter repeat her life. Once the truth is spoken, the physical symptoms begin to fade. Kiran offers to cancel the ceremony to save her daughter. Varsha, now understanding the source of her mother's pain, makes a different choice. She decides to proceed with the marriage, but with her eyes open. The paralysis vanishes as the secret is finally out. Natalie is rushed into the trauma unit following a violent car collision. She is unconscious, and her vitals are unstable. Doctors immediately transport her for a CT scan to evaluate severe head trauma. While Natalie is incapacitated, Philip enters the hospital. He intercepts the medical team and identifies himself as her fiancé. He establishes this false authority before Natalie can regain consciousness. When Natalie finally wakes up, her memory is a blank. The neurosurgeon confirms a traumatic brain injury and significant short-term memory loss. She cannot recall the crash or the events leading up to it. Philip seizes this void. He sits by her bed, holds her hand, and produces a diamond ring. He tells her they are engaged. He claims he proposed just before the accident and that she accepted. Natalie stares at the ring on her finger, her mind unable to find the missing pieces of her life. She accepts his story because her brain cannot produce a contradiction. Will, the man who was actually with her, stands in the doorway. He is covered in his own blood and sidelined by hospital protocol. He watches Philip rewrite Natalie's history in real time. Philip stares back at Will, using the lie to physically and legally bar him from the bedside. Natalie's confusion turns into a forced acceptance of a stranger's narrative. The deception is finalized, anchored by a ring Natalie does not remember and a memory Philip has successfully stolen. Young Thomas sits in a hospital bed, complaining of a persistent headache. Dr. Choi holds up a finger and moves it across the boy's field of vision. Thomas cannot follow the movement. He has lost his peripheral vision. An MRI scan reveals a mass near his pituitary gland. The surgical team identifies it as a craniopharyngioma, a tumor pressing directly against his optic nerves. They schedule immediate brain surgery. The surgeons state that if they do not operate now, the boy will go permanently blind. As the team prepares for the procedure, Dr. Choi notices physical details the specialists ignored. Thomas is significantly smaller than other children his age. His pulse is abnormally slow, and his physical reactions are sluggish. Choi stops the lead neurosurgeon in the hallway. He argues that the mass might not be a tumor, but a symptom of an endocrine disorder. The neurosurgeon is dismissive. He warns Choi that if they delay the surgery and the theory is wrong, Thomas will end up blind or comatose. Choi stands his ground and demands a blood panel before the first incision is made. The results confirm his suspicion. Thomas is severely hypothyroid. The mass on the scan is not a tumor. It is hyperplasia, a compensatory enlargement of the gland. There is no need for a craniotomy. Choi informs the parents that medication will shrink the mass and restore their son's vision. The surgery is canceled. Thomas avoids a high-risk brain operation because a single doctor prioritized clinical observation over a preliminary diagnosis. Noah and April find Jacinta in a dark alley, being kicked and beaten by a group of men. Noah intervenes and brings the bloodied girl to the emergency room. As he treats her injuries, Jacinta reveals a grim reality. The attack was a gang initiation known as being jumped in. She chose the beating voluntarily because the only other option for entry was being sexed in, a ritual of sexual violence. For Jacinta, the broken ribs and facial trauma are a calculated trade for her survival. The situation escalates when the gang leader, Angel, arrives at the hospital with his crew. They stand in the corridor, claiming to be family and demanding her immediate release. Noah realizes the hospital is no longer a sanctuary. It is a cage where the predators are waiting at the exit. He knows that following protocol will return her directly to her attackers. Defying hospital policy and legal boundaries, Noah decides to act outside the system. He bypasses the official discharge process and waits for a gap in hospital security. He sneaks Jacinta out of the ward and transports her to his private apartment. He locks the door, offering her a couch and a chance to heal in secret. He tells her she has 2 days to recover before they find a way to get her out of the city for good. Noah has moved from being her doctor to being her accomplice, risking his medical license to provide the only protection the law cannot offer. Philip enters the hospital with flowers and breakfast, playing the role of a devoted fiancé. Natalie, struggling with memory loss from a traumatic brain injury, looks at the engagement ring on her finger. She has no recollection of a proposal, but Philip uses her medical condition to validate the lie. The deception holds until they step outside that evening. Will waits for them in the shadows. He confronts Philip directly, revealing the truth. Philip slipped the ring onto Natalie's finger while she was unconscious in the ICU. Philip immediately attempts to gaslight Natalie, dismissing Will as a jealous ex-boyfriend trying to sabotage their future. Natalie stands between them, processing the conflicting stories. Her memory is gone, but her instinct remains. She recognizes the hollow nature of Philip's affection. She tells Philip the engagement is over and demands he leave. Philip is forced out of her life, but Will finds no favor in the aftermath. Natalie turns on him, seeing his interference as yet another attempt to manage her life. She rejects his help and his presence, making it clear she does not need a savior. She tells Will to get out of her life as well. Natalie walks away from both men, choosing the clarity of being alone over the pressure of their competing narratives. She leaves the lies and the interference behind, reclaiming her autonomy in the cold night air. Natalie treats a sick infant named Sophie and uncovers a series of lies. Philip, her current partner, is exposed as a pathological liar. He claimed to have no family, but his sister reveals he abandoned his own daughter at the hospital. Philip has even signed a DNR order, instructing doctors not to save the child if her heart stops. Natalie refuses to comply. During a complex heart procedure, Sophie develops pulmonary edema. Natalie ignores the legal threats and implements VA ECMO to keep the girl's heart beating. The high-stakes medical crisis triggers a breakthrough in Natalie's memory. The fog from her accident clears. She realizes Philip manipulated her during her recovery and that she had cruelly discarded her ex, Will. Overcome with guilt, Natalie finds Will on the hospital rooftop. She cries and apologizes, confessing that she finally remembers the truth and still loves him. She asks for a second chance, but Will remains cold. He tells her that their history is nothing but a cycle of hurting one another. He admits that after she ordered him to stay away, his life actually improved. He looks at her without a trace of longing and states that for the first time, he feels free. Will walks away, leaving Natalie alone in the dark. She has regained her memory only to realize she has permanently lost the man she loves. James arrives in the emergency department 8 days after a double lung transplant. He is in acute respiratory distress. Dr. Marcel examines the patient and immediately suspects his own surgical work. He believes a technical error during the transplant caused the lungs to fail. Nurse April reviews the x-rays and notices a specific pattern of consolidation. It looks identical to the COVID-19 cases she handled in the isolation ward. Although the donor originally tested negative, April suspects the virus left hidden damage. She requests a retest using deep lung washings rather than a surface swab. To bypass the hospital's refusal, she secures a signature from a different doctor and forces the lab to process the sample. The results confirm her theory. The donor lungs contain COVID-19 DNA. The virus had caused microscopic scarring that was invisible during the initial transplant, leaving the tissue vulnerable to pneumonia. James's condition worsens. Marcel prepares to connect him to an ECMO machine for total life support. April stops the technician and presents the lab report to Marcel. The surgeon realizes his sutures are fine, but the tissue itself is diseased. He shifts his strategy. Instead of passive life support, he decides to perform a high-risk surgery to resect the damaged lung tissue. The mortality risk is extreme. Marcel operates under intense pressure. Hours later, James wakes up in the intensive care unit. Marcel leans over the bed and tells James to squeeze his hand. James follows the command. The patient is stable. April stands in the hallway, having saved a life by challenging the lead surgeon's assumptions. Will and Dylan are trapped inside a collapsing apartment building as flames engulf the hallways. They carry an unconscious victim through thick smoke, reaching a third-story window. Outside, firefighters extend a ladder and position a rescue basket. Will and Dylan secure the victim and navigate the narrow escape under intense heat. They descend to the street, gasping for air, but the relief is short-lived. Dylan realizes Joe is not among the survivors. He sprints toward the back alley and finds her collapsed on the pavement. She has been shot. A stray bullet has pierced her abdomen, and blood is pooling beneath her. Dylan calls for an ambulance, his hands pressing against the wound. At the hospital, the situation turns critical. Dylan ignores his own injuries and takes over the resuscitation. He performs rhythmic chest compressions, his face drenched in sweat and soot. He orders the nursing staff to administer epinephrine and calcium, but the heart monitor shows a steady, unwavering flatline. The lead surgeon tells him to stop, noting that the blood loss is too severe. Dylan refuses to let go, continuing to push against her chest until his strength fails. He finally stops. He looks at the clock and announces the time of death, 8:04. The room goes silent. Dylan stands over the body of the woman he loves, his professional composure finally breaking into a silent, devastating collapse. He walks out of the trauma room, leaving the medical team behind as the reality of the loss takes hold. Penelope enters the emergency room and hands her infant to the medical staff. She states clearly that she is the problem and that she is going to hurt her child. In a private exam room, she admits to Dr. Charles that she had a specific thought: throwing her son against a wall. Dr. Charles orders an MRI and a CT scan to investigate a physical cause. The images rule out a stroke or a brain tumor. He identifies Bell's palsy, a condition causing facial nerve inflammation. This diagnosis explains her sensory overload. To Penelope, the high-pitched frequency of her baby's crying felt like a physical drill entering her skull. While holding the infant later, the crying triggers a visible breakdown. Penelope begs the staff to remove the child and then suffers a physical collapse on her hospital bed. Maggie enters the room to find Penelope paralyzed by guilt. Maggie does not offer platitudes. Instead, she states a fact from her own past. When her daughter would not stop screaming, Maggie stood by a second-story window and considered throwing her out. This shared confession of a dark impulse breaks Penelope's psychological isolation. The medical team initiates treatment for the Bell's palsy and the underlying exhaustion. Penelope is reunited with her son. The intervention shifts the narrative from potential child abuse to a treatable medical crisis. The family remains together. Jack Dayton stands before the hospital board to unveil OR2. This surgical suite integrates robotics with an advanced artificial intelligence core. It is a gift designed to eliminate human error. At the same time, a patient named Richard is admitted with advanced pancreatic cancer. Every other surgical team has rejected his case. The tumor has invaded the duodenum and surrounding tissues, making it a death sentence. Dr. Marcel decides to use the new platform for a final attempt at resection. The operation takes place under the gaze of investors and media. The AI monitors the surgeon's every move through thousands of sensors. During the reconstruction phase, the system triggers a critical alert. It analyzes the suture spacing and predicts a high probability of a post-operative leak. The AI demands a change in technique. Marcel pauses, caught between his instinct and the machine's data. He adjusts the sutures to meet the AI's parameters. The team then activates vivo histology. This allows for an immediate biopsy of the surgical margins without extracting physical samples. The digital scans confirm the results. The margins are clear. The inoperable tumor is gone. After the procedure, Dayton and the medical staff face a wall of cameras. They announce the complete removal of a terminal cancer. A man who was told he would die is now recovering. The machine did not replace the surgeon. It forced him to be perfect. The first human trial of OR2 ends with a zero mortality record. Jack Dayton stands inside Chicago Med to unveil OR2, a suite of advanced surgical robotics. The hospital administration accepts the gift, treating Dayton as a generous benefactor. The dynamic shifts when a patient arrives with an inoperable pancreatic tumor. Dayton identifies a marketing opportunity and pressures the surgical team to use the new platform immediately. Dr. Marcel protests, citing a lack of training, but Dayton dismisses the concern. He demands a demonstration of his technology's superiority. Before the first incision, Dayton fills the observation gallery with cameras and reporters. He turns a high-stakes surgery into a live-streamed product launch. The surgeons argue that a human life is at risk, not a simulation, but Dayton ignores the plea. He tells them to have faith in the machine. Under the glow of the monitors, the robotic arms remove the tumor with calculated precision. The surgery is a success. Dayton stands before the press, positioned as the man who made the impossible routine. The true objective reveals itself during a staff wedding outside the hospital. As the doctors celebrate, a board member pulls the director aside with a breaking update. Jack Dayton has purchased a controlling interest in the Gaffney Medical Group. The generous donation was a tactical entry point. By proving the hospital could not achieve these results without his technology, he solidified his leverage. Dayton does not just own the machines anymore. He owns the building, the staff, and the medical records. The savior has completed his hostile takeover. 65-year-old Paul Michaels is admitted to the emergency room with scraped hands and torn clothing. He fell down the stairs, his second tumble in a single week. His daughter, Jessica, stands by the bed, recounting how her mother died of Alzheimer's just 1 year prior. She tracks every repetitive question her father asks, convinced she is watching the same terminal decline. Dr. Charles performs a basic cognitive test, asking Paul to remember 3 words: cow, window, and umbrella. When asked to repeat them minutes later, Paul fails. He stares at the doctor, unable to recall a single word. Jessica watches the silence, believing her father's fate is already sealed. The situation escalates during discharge. Paul suddenly stiffens and collapses into a violent seizure in the hospital corridor. Doctors swarm him, pinned against the floor, injecting medication to break the tremors. The suspected dementia has transformed into an acute neurological crisis. Dr. Lan and Dr. Charles order an immediate head CT and a lumbar puncture. They extract spinal fluid, searching for a tumor or a brain bleed. The lab results reveal elevated protein levels and massive internal inflammation. The doctors return with a different verdict. Paul does not have Alzheimer's. He has autoimmune encephalitis, a condition where his own immune system attacks his brain. It is a medical fluke, not a terminal death sentence. They begin administering high-dose steroids to stop the inflammation. Jessica realizes the man she thought was lost is entirely curable. The crushing weight of an incurable diagnosis vanishes. Paul is not disappearing, he is simply sick, and for the first time in months, he is getting better. Nina Simmons falls 3 stories. Her pelvis is shattered. In the emergency room, she consumes 2 units of blood in minutes, but her blood pressure remains stagnant. Outside, an ice storm halts all medical deliveries. The hospital runs a trauma simulation. The algorithm processes her injuries and issues a 7% survival probability. Based on this data, the surgical lead orders Nina move to the ICU for comfort care to preserve the dwindling blood supply for more viable patients. Dr. Halstead sees Nina's nephew, a child already orphaned by a car accident. He defies the protocol. He wheels the patient to interventional radiology, but the specialist fails to access the ruptured vessel and abandons the case. Halstead forces a second attempt in the hybrid room with Dr. Song. They use the hospital's last remaining blood products. As Nina's vitals drop, Song threads a catheter into the left iliac artery and deploys a metal coil. The internal hemorrhage stops. Nina wakes up. The patient's survival triggers an immediate confrontation. A senior surgeon berates Halstead for exhausting 40 units of blood on a single, low-probability trauma during a resource crisis. He states that any deficits in other patients are now Halstead's personal responsibility. Halstead accepts the blame in silence. He watches the aunt hold her nephew's hand. The algorithm predicted death based on historical data, but it could not account for the manual intervention that kept the boy's last remaining family alive. Dr. Crockett Marcel prepares to operate on a patient named Felix. A knife blade has snapped off and is lodged deep within the man's liver. The CT scan reveals 3 separate puncture tracks. To avoid a fatal hemorrhage, Crockett activates OR2, an AI-driven surgical system designed for precision navigation. The procedure begins under the glow of digital imaging. Suddenly, the monitors flash red. An alarm pierces the operating room. The system screen displays a metric, intentional motions, at 74% efficiency. The AI identifies Crockett as a primary surgeon fatigue risk. Without warning, the system locks. The enhanced imaging disappears, leaving the surgical site in darkness. Crockett demands an override, but the technician refuses. The software code, updated by hospital owner Jack Dayton, is absolute. It cannot be bypassed by human command. Crockett is forced to surrender his lead. A junior resident, who has just started his shift, steps in to take over. Crockett stands back, reduced to a supervisor, while a less experienced doctor completes the delicate repair. After the surgery, Crockett confronts Dayton. He argues that a machine should not strip a surgeon of his authority based on an algorithm. Dayton remains unmoved. He reveals that a maintenance check found no system errors. He tells Crockett that the AI's data is objective, while human self-perception is flawed. The machine did not glitch. It reached a conclusion Crockett was unwilling to face. In this hospital, the software now holds the final word on who is fit to save a life. Dr. Hannah finds 2 men dying on a roadside during an intense ice storm. One is a soldier with a severed artery in his right leg. She applies a tourniquet, tightening the strap until the arterial bleeding stops. The second victim, Paul, is gasping for air. Shrapnel has punctured his chest, causing his lung to collapse. With no medical supplies available, Hannah drags the men into the back of a truck. She searches a metal toolbox and finds a plastic snack bag. She cuts the wrapper and tapes it over the wound in Paul's chest to create an improvised occlusive dressing. The airtight seal allows the lung to re-expand, and Paul's breathing stabilizes. The temperature outside continues to drop as Hannah monitors their vitals in the dark. Headlights eventually cut through the blinding snow. Sean Archer arrives in a heavy snowplow, the only vehicle capable of moving through the storm. He loads the survivors into the cab and clears a path to the hospital. Hannah enters the emergency department covered in grease and blood. She provides a clinical handoff detailing the injuries and her improvised field procedures. The senior surgeons watch in silence as she explains how she saved a man's life with a piece of trash and a toolbox. Her performance under extreme conditions earns the immediate respect of the entire trauma team. Hannah remains calm, her focus entirely on the patients she just pulled from the ice. Quentin stands in the delivery room as his son is born. He suffers a sudden psychotic break, denies the child is his, and flees into the hospital corridors. He enters the MRI suite while holding a pair of metal scissors. The magnetic field pulls the scissors into his neck, pinning him against the machine. The blades are lodged near his carotid artery. The medical team realizes that turning off the magnet will cause the scissors to shift and sever the vessel. Quentin would bleed out in under 20 seconds. Standard surgical tools are made of steel and cannot enter the room. The engineering team is summoned to the robotics lab. They use 3D printers to manufacture plastic forceps, clamps, and scalpels. These non-magnetic tools are rushed to the MRI suite. The surgeon enters the high magnet zone and begins the procedure. He uses the plastic instruments to clamp the artery while the scissors are still held in place by the magnetic force. Once the vessel is secure, the team shuts down the power. The scissors are removed without further trauma. Quentin survives the surgery. A follow-up diagnosis reveals that he has neurofibromatosis type 2. The condition remained hidden until a recent change in his diet, intended to support his wife's pregnancy, triggered a metabolic crisis and the subsequent psychosis. Quentin recovers his mental clarity. He returns to the maternity ward to hold his son for the first time. The family is reunited in the recovery room. The hospital board is deadlocked over a vote to convert the facility into a for-profit institution. Jack Dayton leads the push for privatization, but he lacks the necessary two-thirds majority. Vernon, a veteran board member with 23 years of service, stands as the final obstacle to the deal. During a high-stakes meeting, Vernon suddenly loses his balance. He complains of a persistent headache before collapsing onto the floor in a violent seizure. Medical staff rush him to the emergency department. A CT scan confirms an acoustic neuroma pressing against his brainstem. The neurosurgeon warns that traditional surgery carries a high risk of permanent facial paralysis. To save Vernon's quality of life, the team decides to utilize OR2, an advanced surgical navigation system that uses AI modeling for real-time precision. Jack Dayton watches as the very technology he campaigned for becomes Vernon's only lifeline. The surgery is a success. The AI system maps the delicate nerves, allowing the surgeon to complete a full resection without complications. Vernon wakes up in recovery with his hearing and facial movements fully intact. He is visibly shaken by the efficiency of the machine. When the board reconvenes for the final vote, the atmosphere shifts. Vernon realizes that the cutting-edge technology that saved him requires massive capital investment. He walks into the boardroom and casts the deciding vote in favor of Jack's for-profit plan. The hospital's status changes instantly, the opposition is silenced, and the era of medical commercialization begins. Ashley stares at her latest CT scan. The images reveal 4 new lesions in her brain. For 30 years, her medical records have carried a single, lethal label, anaplastic astrocytoma. It is a terminal diagnosis, usually ending in death within 3 years. Yet, Ashley is still alive. Dr. Zola notices the anomaly. The math of a 30-year survival rate for this specific cancer is impossible. Ashley is exhausted. She recounts a life defined by hospital walls. Since 1991, she has endured relentless rounds of radiation and chemotherapy. Her body is a map of medical trauma. Her bones are brittle, her eyesight is failing, and her hormonal system is shattered. When the doctors suggest a new biopsy, she refuses. She tells them she would rather go home and die than let them cut into her brain again. The doctors dig into the archives, finding a paper pathology report from 1991. It reveals a hidden conflict. A junior pathologist originally marked the tumor as benign. However, an elite cancer center overruled the finding, insisting it was malignant. The expert opinion became her reality for 3 decades. The doctors explain that modern molecular testing can provide a final answer that 1991 technology could not. Ashley agrees to one last procedure. The results come back, the tumor is benign. The room goes silent as the truth hits. For 30 years, Ashley lived under a death sentence that never existed. She never had cancer. Every treatment, every fear, and every lost opportunity was the result of a single medical error. Ashley collapses on the bed, sobbing as the shadow of 30 years finally lifts. Dr. Archer stands in the boardroom, dismissing the Vascom as an overpriced gadget. He compares the cutting-edge AI monitor to a redundant smartphone and calls the traditional CVP method a reliable flip phone. To him, the expensive new technology is nothing more than a high-tech repackaging of data that doctors have accessed for decades. Dr. Cooper sees this defiance as a direct threat to his Grand Rounds presentation. He corners Dr. Halstead in the corridor with a calculated proposal. Cooper points out a specific technical vulnerability. The CVP monitor requires precise manual calibration to remain accurate. He tells Halstead that if Archer's device fails during a critical procedure, the Vascom will be the only tool left to save the day. The instruction is silent but absolute. A deliberate calibration error would ensure their professional assent. The conflict shifts to the operating room. Archer begins the procedure, relying entirely on the CVP readings. Halstead stands inches away from the monitor's controls, watching the fluctuating data lines. A single physical adjustment to the hardware would invalidate the readings and force Archer to concede. Cooper watches from the doorway, waiting for the sabotage to begin. The room is silent, punctuated only by the mechanical pulse of the life support system. Halstead looks at the sedated patient and then at the equipment. He weighs the promise of a career-defining promotion against his medical oath. His hand hovers near the interface, but he does not interfere. He refuses to manipulate the settings. The CVP remains steady, providing accurate data until the end of the surgery. Halstead leaves the room, choosing his integrity over a rigged victory. Dr. Stevie Hammer finds her mother, Terry, living in a van in a restricted tow zone. Terry is feverish, her arm gripped by a severe MRSA infection. She refuses to stay in the hospital, citing a deep-seated distrust of the medical system. Stevie views her mother's refusal as a fatal mistake. To bypass her mother's resistance, Stevie introduces nanodrug technology. These smart pills contain microscopic sensors that transmit a signal to a smartphone app once they dissolve in the stomach. Stevie begins tracking her mother's medication compliance without her consent. The surveillance is soon exposed. Terry discovers she is being digitally monitored and flees the hospital in a rage. Stevie, driven by a desperate need to save her, escalates the conflict. She uses her professional connections to have the city sanitation department tow Terry's van, her only source of shelter. Stevie believes she can force her mother into submission. She is wrong. Terry stands on the dark street, devastated and stripped of her last possession. The control has not cured the infection, it has only destroyed the relationship. Stevie watches her mother collapse in grief and finally understands the cost of her interference. She orders the return of the van and hands the bottle of medication back to Terry. She stops fighting for control and leaves the decision to her mother. Stevie steps back, allowing Terry the autonomy to choose her own life or her own end. Dr. Dylan Scott treats a young girl for a broken arm, but his focus shifts when he looks at her father. He recognizes Brandon Murphy. 10 years ago, before Scott traded his badge for a stethoscope, he arrested Brandon for assault and battery. The girl's medical history reveals a series of suspicious falls and head injuries. Scott's police instincts take over. He ignores the parents' explanations and calls the Department of Children and Family Services. A social worker begins an immediate investigation, threatening to remove the child from the home. The mother, Kate, insists they are a loving family, but Scott sees only a repeat offender. At the last moment, Scott returns to the radiology lab. He places 2 CT scans side by side, one from last year and one from today. He measures the cerebellum. It is smaller. The brain tissue is wasting away. He identifies the cause as cerebellar atrophy, a hallmark of late-onset Tay-Sachs disease. The girl isn't a victim of violence. She is suffering from a terminal genetic disorder that destroys her coordination. Scott stops the child abuse investigation and admits his error. He delivers the diagnosis to the parents in a quiet room. Brandon is no longer a suspect, but his daughter is dying. The medical facts dismantle Scott's prejudice, proving that his past as a cop almost blinded him to the truth. He saves the father from prison, only to leave him with a terminal reality.